Do you know what vaccines your dog needs throughout their life? It's a question that might seem overwhelming, but with a little guidance, it's one you can confidently answer. Let's dive into the world of dog vaccinations. Vaccinations play a crucial role in maintaining your dog's health. They act as a protective shield, warding off common and severe contagious diseases. Now, there are two types of vaccines your dog may need: core and non-core. Like the name suggests, core vaccines are fundamental. They're recommended for all dogs, irrespective of their lifestyle, age, or environment. On the other hand, non-core vaccines are a bit more tailored. They're not necessary for every dog. Instead, their administration depends on various factors like age, environment, lifestyle, and overall health. It's like getting a custom-made suit for your dog, but in this case, it's a custom-made protection plan. So, are you ready to take a journey through your dog's life, learning about the vaccinations they'll need at each stage? Imagine you just brought home a cute, cuddly puppy. What vaccinations does this little one need? Well, let's dive into that. Just like newborn babies, puppies have an early start when it comes to vaccinations. From as early as 6 to 8 weeks of age, your little furball should start receiving its first round of shots. This early protection is vital in safeguarding your puppy from common and severe contagious diseases. It's important to note that vaccinations aren't a one-and-done deal. Your puppy will need booster shots until they are about 16 to 20 weeks old. Think of these boosters as reinforcements, ensuring that your pup's immune system is robust and ready to fight off any potential health threats. One of the critical core vaccines is the DAP shot. Administered in a series of shots, the DAP vaccine stimulates the production of antibodies, providing immunity against distemper, adenovirus, parvovirus, and parainfluenza. These diseases can pose serious threats to your puppy's health, so it's crucial to ensure they're protected. The Puppy DAP series typically costs between $60 and $150. Rabies vaccinations are another must. They're not just recommended, they're required by law. Your puppy should receive their first rabies shot at around 12 weeks of age. The cost of a rabies vaccine ranges from $15 to $50. Remember, these initial vaccines are just the starting point. Your puppy will need regular wellness visits and screenings as they grow older to maintain their health and keep them in tip-top shape. As your puppy grows into an adult dog, their vaccination needs change. So what are these changes? During your dog's transition from puppy to adult, one of the most important vaccinations they'll need is the DHP vaccine. The DHP vaccine offers continued protection against distemper, hepatitis, and parvovirus, ensuring ongoing immunity. Without DHP vaccinations, adult dogs remain susceptible to severe and potentially fatal infections. Similar to the DAP series, the DHP vaccine stimulates antibody production against distemper, hepatitis, and parvovirus. The cost of the DHP vaccine ranges from $20 to $60. Another disease you should be aware of is kennel cough, also known as bordetella, which is a highly contagious respiratory disease. If your dog is frequently in environments with lots of other dogs like dog parks, daycare, or boarding facilities, this vaccine can be a real safeguard. The cost of the bordetella vaccine varies but is typically around $20 to $45. Now let's talk about the canine flu vaccine. Like the human flu, canine influenza is highly contagious and can lead to serious complications in some cases. If your dog is often around other dogs or travels with you, getting them vaccinated against canine flu is a wise choice. The vaccination schedules for these non-core vaccines can vary, so it's always a good idea to consult with your vet. They will consider factors like your dog's age, environment, lifestyle, and overall health to determine the best vaccination plan. Remember, each dog is unique, and what works for one may not work for another. But one thing is certain, vaccinating your adult dog helps them stay healthy and enjoy their playful years to the fullest. Finally, as your faithful friend enters their golden years, their vaccination requirements change yet again. But how, you may ask? Well, let's delve into that. At this stage in your dog's life, regular wellness visits and screenings become even more crucial. As dogs age, their immune systems can weaken, making them more susceptible to diseases and infections. Regular checkups can help detect any health issues early on, giving your furry pal the best chance at a healthy and happy life. Vaccinations continue to play an essential role in your senior dog's healthcare routine. However, the focus shifts more towards non-core vaccines, which are given based on your dog's risk of exposure to certain diseases. For instance, let's talk about leptospirosis and Lyme disease vaccines. Both of these vaccines are considered non-core, meaning they're not necessary for all dogs. But if your dog is frequently exposed to environments where these diseases are prevalent, like wooded areas or places with stagnant water, then these vaccines could be vital. Leptospirosis is a bacterial infection that can lead to severe kidney or liver disease, while Lyme disease, transmitted through ticks, can cause joint inflammation and other health issues. So if your senior dog loves to explore the great outdoors, these vaccines might be a worthy consideration in their golden years. But remember, every dog is unique, and their vaccination needs can differ based on various factors such as their overall health, lifestyle, and environment. That's why it's always best to talk to your vet about the most suitable vaccination regime for your senior dog. While their pace may slow down, ensuring your senior dog's vaccinations are up to date can help them enjoy their golden years in good health. So, let's give our loyal companions the care they deserve, ensuring they continue to fill our lives with joy and unconditional love. Apart from the core and non-core vaccines, did you know there are other vaccines available? That's right, vaccines like the rattlesnake and canine coronavirus vaccines. While these are not commonly recommended, they may be available depending on your dog's specific needs and environment. Now, let's take a brief moment to summarize what we've learned about dog vaccinations. Vaccinations are an integral part of your dog's health, helping to prevent a range of diseases. They fall into two main categories: core and non-core. Core vaccines are essential for all dogs, protecting them against common and severe diseases. Non-core vaccines, on the other hand, are given based on factors like your dog's age, environment, lifestyle, and overall health. Puppies should start their vaccination journey between 6 to 8 weeks old, with booster shots continuing until they're between 16 to 20 weeks old. Rabies vaccinations, required by law, should be given when your puppy is around 12 weeks old. As your dog grows into adulthood and later into its senior years, regular wellness visits and screenings become increasingly important. Remember, each dog is unique and their vaccination needs may vary. But what's the common thread here? Well, it's the importance of vaccinations in keeping your dog healthy and happy throughout their life. They're not just a medical routine, but a key part of responsible pet ownership. For more information, you can reach out to organizations like the American Veterinary Medical Association, the American Animal Hospital Association, or your local animal welfare organization. They can provide you with the guidance and resources you need to ensure your furry friend stays protected. Remember, keeping your dog vaccinated is a key part of responsible pet ownership.